The CDC announces that when it comes to certain vaccine-related decisions, it's backing an advisory panel chosen by Health and Human Services Secretary Robert F. Kennedy Jr. Among the recommendations that are now backed by the CDC is to split up doses of the MMR and the MMRV vaccines in children. Joining us to explain what this means for parents and their doctors is our local pediatrician, Dr. John Cox. So, doctor, really quick, for those who may not be familiar with the acronyms, what are the MMR and the MMRV shots for?
Yeah, the MMR stands for the measles, mumps, and rubella, and that is typically a vaccination that kids will get at age 1 to 18 months, and then age 4 to 6 for their second booster. The V portion is the Varivax, or the varicella virus, which is the virus that causes chickenpox.
Okay.
So that's
yeah, and the CDC wants to break this down. So they're saying kids should get their first MMR doses at 12 to 15 months and the second at 4 to 6 years old. How were they handled before this recommendation?
Traditionally, at least in my office and what most of the pediatricians do in the area, is you get an MMR and then a chickenpox vaccination at age 1. And then usually at that 4 to 6 range, we get your booster. That's when we combine them to the MMRV. And that is traditionally just to save kids pinches. Why give a kid multiple injections when you can handle it all in one? So usually we will split the first one at age 1, or that first initial shot, and then we do the combination product at between ages 4 and 6.
As a doctor, looking at the research so far, what's the decision based on? Is it just children will handle this a little bit better if you break it up?
Actually, I'm not quite sure why the recommendation, to be honest with you. But there's been studies for the last 50 years, 25 different studies worldwide over 3 different continents to prove the MMR and the MMRV are both safe, are all safe vaccinations. Splitting them up provides a couple different areas of concern, I think. Number one is we don't even make those products in the United States anymore separately. So to be able to get some of the manufacturers to separate them and make them safe, that's going to be a little bit of problematic. And also, when you break them up, you're giving your child more injections. So instead of 3 different injections over a 4 to 5 year span, you're giving 6 different injections. That could mean people might miss things. That might mean they might not get certain things. It also is cost prohibitive. So without any real science and proof back behind it, I'm not quite sure why they decided to make this recommendation, honestly.
Do you know if the parents want to get them all at once, will their insurance cover that still based on the CDC recommendation, or could they get denied?
Well, at the moment, it's still going to stay status quo because that's just what we've been doing for 50 years. The breaking them up, that is where the insurance companies, if they don't get the recommendation from the CDC, and unfortunately the guy making the decision is not a doctor or a scientist or a clinician, he's a lawyer, and so I think consulting those people first is going to be the key. But insurance companies could decide, if the CDC doesn't recommend it that way, they might not pay for it, which then I think, again, puts the pressure on parents, and it's costly.
And based on what you know about the diseases themselves, do you foresee infections ramping up for toddlers or kids if they do make some changes because of, what you know about those diseases and what they're getting these vaccines for?
Yeah, I mean, we've already been seeing that because some of the confusion with some of the different messaging that's been going on, parents are getting confused, and I urge them all to talk to your pediatricians about this. But the confusion means less people are getting injections and getting their vaccinations, and we're already seeing the rates of pertussis and measles and things go up. We've had more measles deaths this year than we've had in the last 35, 40 years. So those things are preventable. So I think if we split these up, that means more people may miss those or not be able to afford those. And I think that just means more illnesses for kids. And that's not what we're looking for.
Well, thank you so much for joining us here. That's all the time we have, but I appreciate your information as we watch the changes take place. Thank you.
Appreciate it. Thank you.